This is Sheila from Body Center St. Pete, and I'm going to show you a short routine to help nerve entrapment pain, which can be kind of numbing, tingling, like your hands falling asleep, or an electrical, like almost lightning bolt down the arm. The nerves begin in the cervical spine, and they go between the scalenes, underneath your pec minor, and then they kind of branch out depending on which nerve might be entrapped. And they end up in the forearm and all the way down the fingers. But it all starts here. We're going to start by stretching the scalenes. You can grab a TheraBand. If you don't have a TheraBand, no worries. You can use a towel or a belt. I like a TheraBand because there's some give. But what you're going to do is step on it and then hold the other end so it tugs your arm down. And in opposition, you're going to lean the top of your head over towards the opposite side. And so you're going to be stretching the scalenes. And in the scalene stretch, you have a front, a middle, and a back. So you get the front one, keep your head tilted to the opposite side as the band, but let your nose point up a little bit. And that stretches the anterior scalene. And then let the nose point directly in front of you, and that'll stretch the middle scalene. And then allow the nose to turn down, and that'll stretch the posterior scalene. You can stay in this stretch for up to a minute, minute and a half. Get a good opening through the scalenes. So one of the best ways to self-massage pec minors with the ball, if you come to your collarbone and go towards the outside edge of the collarbone, you're going to find a little nub that's a little tender. That's the coracoid process. It's right under your collarbone. And that's the attachment of the pec minor. So take a ball and put it against a wall in a door frame or in a hallway where you can actually lean forward and lunge into it. So I can let my body pass the wall that I'm pressing into. So I have the ball against the wall right at that coracoid process. So it's the kind of the outer edge of the collarbone. Right underneath it, you'll feel a tender little knob there. That's the coracoid. From there, you press the ball and just lean into it. When you find a very tender spot, stay there for about 10 to 15 seconds. So after your pec self-massage, you can actually do a pec stretch. So if it's comfortable enough to get your arm all the way up to above shoulder height, the line of pec minor follows this diagonal. So you want your arm on a high diagonal so you do get a stretch. Then you're going to twist by walking your body in a little circle. Twist your body away from the arm that's on the wall, and you're going to get a big stretch along the top of the pec minor here. You want to be mindful that your shoulder doesn't get stuck going forward. That's an important part. So you want to keep the front of the shoulder back as you go around to feel the stretch. You might want to play around with the angle of this arm a little bit. I like the high diagonal for pec minor, but it might be not as comfortable there. You might want it a little lower. So just basically look for the most kind of effective stretch for this area right here. All right, so for neck mobility, general neck mobility, I definitely recommend neck circles. So you're going to start with your torso upright, and just bending from the neck up, you'll drop one ear towards one shoulder, and then drop slowly your chin to your chest, and then you round out to the opposite side and come back up. I like to just do the half circles to begin. You drop one ear to one shoulder. I like reversing it, so you kind of get a different sensation coming from a different direction. And then once you're warmed up in the half circle, you can start to go into a full circle, which is dropping, going down. Once you get to the other side, really lengthen through the head so you're not crunching down, but you're creating length as you go all the way to the back. You come right back up. And then the opposite side begins all the way around. Now when you get to going to the back, I want you to lengthen through your head so you're not letting it just drop to the back. You're really reaching through the crown all the way around and back up. Finally, we want to restore the curves in the cervical neck. Usually when there are nerve entrapments, there's a loss of cervical curve. That's the general usual way the neck goes, especially nowadays with our devices and computers and always looking at technology. We tend to get a flat neck and a forward head posture. So restoring the neck is pretty simple. You just grab a hand towel. I have it folded in thirds and then rolled up. You're going to put that right behind the neck. Make sure it's comfortable. Close your eyes and relax.